In your commentary you say that there's only a 1% relationship from gout to diabetes, and I don't agree with that. According to one specific study, women who suffer from gout has a 71% chance of becoming diabetic, and men had a 22% higher chance of becoming diabetic. And for every 1 milligram per deciliter that the uric acid rise, the chance of getting diabetes increased by about 20%. So it depends on where you get your information from. But Dr. Perlmutter in video number 12, this is what I was talking about in that particular video that you were commenting on. It's not just about gout. Uric acid levels traditionally were only a concern with gout. Typically, when you go to your doctor will test your uric acid levels, and if it's in the range of 7, he will say, no, if it's above 7, then you will have to make a plan and get your uric acid levels down, because you will get gout. And that was the main concern. But Dr. Perlmutter say in that particular video number 12 on my blog, that actually from 5.5 and above is metabolic concerns, metabolic problems that set in with high uric acid levels from 5.5 and upwards. In fact, it's not only about the gout. For instance, high uric acid levels has a risk factor of 16% for all-cause mortality, with other words, dying of any cause. And for every percentage that it goes up above 7, 8 to 13% is added every time you go up 1 point. With other words, the risk become quite big, but that's only for all-cause mortality. There is also a risk for stroke of 32% and for cardiovascular mortality of 38%. So uric acid is not just about gout. In one specific study, Alzheimer's disease has a risk factor of increasing by 55% if you have high uric acid in your body. So why do I say that? Typically, high uric acid levels will cause your body to down-regulate metabolism, and it will cause your body to go into survival mode. It basically inhibits an enzyme called cis-aconitase, and cis-aconitase is responsible in the mitochondria of your cells for energy metabolism, and it basically tells your body to store more fat and not to burn fat, and to down regulate energy consumption. And then you go into a weight loss stall. But as I explained in earlier videos, you can actually do the opposite. When you eat a low carbohydrate diet and you don't eat a lot of salt, and you get your uric acid levels under control, you can go into ketosis, and you can also stimulate the pathway of upregulating your metabolism to burn more energy and to burn fat. Specific study proves that if you go on a very low salt diet, you can actually stimulate mitochondria production in the cells. So mitochondria are the energy source of cells, and by eating a very low salt diet, you can actually stimulate mitochondria neurogenesis. So you can stimulate the body to boost the metabolism. And you can stimulate this pathway also by exercising. And because of that specific efforts that you are putting in, you are stimulating the pathway of AMPK or AMP kinase, and it basically tells the body burn fat, don't store fat, and don't down regulate your metabolism, upregulate your metabolism. So as I said in earlier videos, when you eat a lot of salt, you can within 5 days become insulin resistant. And insulin resistance is not only caused by eating excessive salt, but it's also caused by eating a high carbohydrate diet and a high unsaturated seed oil diet. But as I said, that because of high uric acid levels, you can stimulate the body to go into a survival mode and basically trigger it. High uric acid levels trigger the polyol pathway, and it stimulates the body to produce fructose from glucose, and glucose becomes uric acid, of course. And again, that's a vicious cycle, because the higher uric acid stimulates the body on the AMP kinase enzyme to down ratchet your metabolism and to store more fat, and not to burn fat for energy. So it basically tells the body winter is coming, starvation is coming. So it's important to realize that we don't know everything, and that's why I encourage people to empower themselves and educate themselves, because many times your doctor will not even have this particular information. As I said in an earlier video, this information is quite new. It came out in February of 2022. It's video number 12 on my blog. So if you eat salt lightly, it should be fine. But if you eat salt in excess, it's not a great idea. We know that there's a link between obesity and eating a lot of salt, and now we know why. It's because of the polyol pathway.